Yes, sir, brother.
What's up, my friend?
Nothing much, man.
All right, let me get my
All is
thing
good.
all set up here.
All is
Boom.
good.
We are ready to rock and roll. What's happening, everybody? We are live. Happy Hump Day!
Yes, yes, sir, brother. Excuse me, real quickly.
How you guys stay, everybody? Having a good week so far? It's the middle of the week.
Yep.
Hope y'all having a great week. Man, things are changing quickly every day. It's always been moving quickly since over a year ago now. We're happy to announce that tonight we have Dr. Janet Berreman, our Kauai District Health Office boss, as well as Dr. Kapono Chong Hansen, who's going to enlighten us tonight. I don't know what we're going to talk about, but I'm sure whatever we talk about is going to be fun and exciting and informative. So sit back,
Oh,
fasten your seatbelts, and let's go. Of
yes,
course,
sir.
don't forget to share, guys. Share.
Yes,
One of
where's
the most important things of getting through this pandemic is to be informed. Be informed, and I think that's critical. And be informed by the right information and the factual information, and not. I mean, there's so much trash on social media about this pandemic from all angles. So it's important that we be informed, we be educated, so we can make great decisions for ourselves and our families. So I'm happy about tonight, Dr. Berman and Dr. Capono. Looking forward to it. I'm sure we got a lot of questions, so we're gonna have some fun tonight. We're gonna have to have a contest, Charlie. We're gonna have to have a contest one night. Who has the better share sign?
oh you of course, brother.
No,
You
yours is classy. Yours is colorful. Mine is just blah, straight and to the point.
no, the reason why it's colorful because that's the only pen I could find for write the word share. Yeah, but
Shauna says hindsight is 2020. I know, man. And in a pandemic, it's better to be ahead of it. It's better to be proactive. And I think one of the things our decision makers got to really think about is look at other places, look at the what's going on in other places that are similar to ours, and then use that as a guide and learn from that. It's so much better. And again, being proactive comes with consequences. We understand that, but to go and wait for something to happen and then react, which is what our state tends to do in most cases, the impact is greater, the cost is greater, and so we'll see. We'll see what happens.
well, today we got a notice this morning. You and I both had a notice about the U.S. General Consulate, U.S. General Consul, I should say, over in Bermuda, and it was kind of it was a it was something to behold because why? Bermuda has a population base similar to Kauai, right?
Yep.
And what the informant said was, let's take a look at it real good and let's do a comparison because right now they are on lockdown because they had a spike of 877 cases. And so they're pretty much in the same boat as we are. They're a tourist destination, right? Tourism. That's their number one economy. And
There's just too many similarities, Charlie,
yeah.
between Bermuda and Hawaii or
Hmm.
Kauai. Way too many similarities to ignore this. This was done, dated April 12th, which was
Right.
just 2 days ago.
Yeah.
And this is from the U.S. consulate. This is, from Bermuda, which is made up of U.S. people that are consulates. But this is the deal, yeah. 877 active cases on the island. Island is very similar to Kauai, 60,000 residents, rely on tourism. In fact, starting yesterday, they started the stay-at-home order for at least
Yeah.
7 days. You see what they do though? They're going to do it in chunks, and if they can isolate and contain the virus, then they'll react at that point. But so this is what just came out. This is straight from the consulate.
Hmm.
So check it out if you don't believe me.
No, it's there, right there, right there in the bar, the top bar,
Yep,
and it came from the Consul General Hamilton. Consul General Hamilton put it out there.
that's it right here from Hamilton, Bermuda.
Yep.
So again, I think these are the places, and they're gonna say, yeah, yeah, but, well, but my point is this. I think Charlie and yours as well, as I read your post.
Hmm.
These are the kinds of things we got to pay attention to. We as decision makers and leaders in our state gotta gotta check it out.
Well, the only reason I posted it is one, it's a pretty good general topic for discussion. That's one. Two, I've learned to kind of readjust my attitude just so um, you just be on the lookout, really, because there is nothing that I personally can say or do to change anybody's mind, not at this point, especially with our officials. They're going to do what they want to do, but yet I am in control of one, getting up in the morning, making me coffee. I'm in control of jumping in my car and going where I want to go. I'm in control of going to the store and whether or not I want to go through those doors because I may see a whole group of people in there without their mask. And I have that decision making power in my own reach, and I will rely on that. I will not, sometimes this is just because you're right, just because you hear this in accident reconstruction. I had the right of way. Sure, you had the right of way, but you need to be defensive. But I had the right of way. I know you had the right of way, but look now, you got no car. Your car is completely damaged. So you can be right all you want to be. You just don't have a car. You got into
Yep.
an accident. So sometimes you got to heed certain cautions. And just because you're right doesn't mean you force the issue to make it right because you might come out the loser in the end. So it's just one of those things. But I think it's very, very interesting that we have a lot of things that's going on around us. The great thing about it, and I did a post this morning, a video, is that we have viewers that have taken it upon themselves to be cautious, and I'm so glad of that because you can see it from their comments. You can see that they realize that things are maybe turning the corner. We're not out of the woods yet, but they're continually staying cautious. Like I had my second shot, but definitely I'm still going to wear a mask. That's what I like to hear. Nobody is taking the position, well, I am vaccinated, therefore uh, I'm not worried, and I'm glad our viewers are erring on the side of caution. That brings that makes me feel good. That makes me feel good.
Yep. 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 Yeah, it's again, it's just I think cautious. Erring on the side of caution is probably the best thing we can do. Um,
Yep.
and I'm hoping that's what will happen. I'm hoping that is what will happen, and that we will be listening to what's happening around us, around the world, and making decisions. Was interesting today. I saw on the news, or I was listening on the radio actually driving home, and I heard one of the newscasters on the radio talk about that the governor said yesterday, as far as the passport, that he's not going to make any decisions or changes until we implement or have a system in place that can validate and verify vaccinations. And they are working to that end. I did hear in the news yesterday, I think, that General Hara is meeting with the governor on Friday. So they'll have the discussion, and we're hoping to get General Hara on our show next week. He did say once he got everything squared away here. So I'm looking forward to that discussion. But interesting to see what the governor will do. He's already come out and said that we will. He's approved it. He's leaving it up to Haima to make the decision, but I'm curious to see where it goes from here. Because now, again, understanding now we get the Johnson and Johnson situation that is going to limit the number of vaccines we put out, and I think Dr. Berreman and Dr. Kapono will address that tonight. But uh, the the goalpost has moved now because, well, it should have, right? Because we're relying on getting as many people vaccinated as possible before we allow people to come in. But this is just going to extend the date because obviously we have less vaccines. So it'll be interesting to hear the perspective of the doctors tonight.
Well, the trial studies, I was just watching MSNBC, one of the advisors to the president, female doctor, very, very knowledgeable at Boston, and she's also at the Boston Clinic or Boston University, one of the two. But she says that there are three groundbreaking news that was made today, and that is, Moderna announced, along with Pfizer, of their efficacy after 6 months. That definitely it shows a high rate of the efficacy, and that it's remaining intact 6 months. So they'll probably go beyond that. So that's a good sign. Moderna, I believe, had done the clinical trials, and from those trials, it looks darn good for ages 12 to 15 can take the vaccine. So the only question with regards to the J&J though is, I guess when they were doing the clinical trials, why weren't there any blood clots detected at that time? I guess that was one of the questions. And
Good question. That's a
yeah,
good question.
it was one of those, because I'm pretty sure that if they saw it, but you know what, that brings up the point. Remember when we talked about, when you're rushing, and that's why the FDA gave only an EUA, because it was a pandemic. They needed something now, not later, and they gave an emergency use authorization now. It was one of those things that, bingo, some things just didn't get vetted yet because it was just too soon, right?
Hmm.
So I think those were some of the questions that were raised. That when you give an EUA, you can't expect that it's a full FDA approval. It's not. And I think the sooner everybody understands that, and like my post said, I am damn glad I got vaccinated. But yet, when I put a comment in there to let everybody know, you still have to look at certain things that will happen because it's happening now. We don't know why. We don't know why. I mean, just look at our numbers, right? Our numbers are low now in Hawaii. But you ask yourself, why are we low, and yet the rest of the states are high? There's something that's got to that sets us apart. And I've always said, because there's water between us. Now, those low numbers can run away from us if we're not careful about what comes into the state. And that's only been my gripe is I want to keep numbers low, but come on, let's let's do it in a right way where we don't have to go scrambling like other places in the US are doing right now. That's all I'm
Yeah.
saying.
Sukano says dates should not be announced to the media until the programs are vetted by the mayors and the governor and the respective team. It only confuses people. Exactly. And, that's why we spoke about this many times, Sue, Charlie, and I, about putting dates. This virus doesn't operate on a date, on a calendar. And, when people come out and say, hey, we plan to open this up by April 1st or May 1st, you know who I'm talking about, the lieutenant governor. And I think that just it causes concern. It causes people to be, number one, false hopes. False hopes when we know it's not going to open up by May 1st because of the logistics involved. He knows that, but he chooses to pick a date, whatever.
No, but don't you notice that when you give a date, say you give a date, actually people are already ramping up 2 weeks prior too.
Yeah. No, it's anyway.
Yeah.
So yes, Sue, thank you for bringing that up. And somebody just asked me if I'm concerned. Hold on here. Am I worried? Who said that? Laurel asked if I'm worried because I took the J&J. No, it's a very small number of people that took the. I think you will find reactions with any vaccine that you take. And so it's been 2 weeks for me. I feel fine. I haven't had any really serious side effects. So while I'm looking for those symptoms, because I'm within the 3 week window, I feel fine. And, I appreciate them coming out and letting us know
Mhm.
so we can, if in fact I start getting a headache or leg aches or whatever, I can go see my doctor. But no, I mean, I knew that there was a chance. We all knew that this is an emergency use only license, and that we're basically jumping in on the trials, and I'm okay with that. But
Well,
I
just
would definitely recommend anyone that had J&J, and I don't care how minor the symptoms might be, you might want to contact your doctor. That's my only.
the seriousness of the J&J, the way I looked at it, while the numbers are very, very small, but just so happened, those small numbers had very, very serious side effects.
Yeah,
It
yeah.
wasn't six of them having side effects, one serious, the other five was, and these are like pretty darn serious, and one led to death. So I think that warrants a real good look at it. But
And
you
that's
know,
what they're doing.
yeah.
So anyway, Dr. Berreman is in the room. We'll bring her in right now. I'm
Mhm.
sure she has a lot to say about that. Hi, Dr. Berreman.
Yeah.
How
Oh,
are you,
she's
Auntie? How are you, Auntie?
I'm fine. I thought you said, "How are you, Kathy?" And I was laughing, but Auntie is even better.
Welcome back on the show, Dr. Janet Berreman from the Department of Health. How are you doing?
I'm doing well, thank you. It's a pleasure to be back.
Well, appreciate you guys coming back on. And while we wait for Dr. Kapono,
Mhm.
yes.
what's going on there, Dr. Berreman? What's happening? What's the good news?
Well, the good news is we're doing really, really well in vaccinating people here on Kauai. We lead the state substantially, and we should be proud of that. It's partly what all the partners who are doing the vaccinating have done, but it's also all the people stepping up and making appointments and coming to get vaccinated. So that's great. We've I think the latest numbers are 43% of our population has gotten at least one dose, and about 32% are fully vaccinated. So that's great.
Standing.
It's not herd immunity yet, but it's really excellent progress.
Hey, Doc, let me ask you that, given what you see with Kauai and its vaccination program, as well as the vaccination programs in other counties, what makes Kauai so different? I mean, it seems like we're very, very disciplined here. When the word went out to get vaccinated, everybody they marched to that tune. And the numbers are high, just by what you've just shared. What do you
Oh,
think
yeah.
made the difference?
I really honestly think that it's a lot of what's made the difference over the last year in COVID-19, that we are relatively small, that we have really strong and collaborative and coordinated leadership from the mayor's office, from the health department, from our healthcare partners, from community partners. And I think that it's in part Kauai's history of understanding that we are all in situations like this together, and that we need to do the best by each other if we're all going to get through okay. But scale really does make a difference. We're not trying to vaccinate 1 million people. We're trying to vaccinate 75,000 people, or fewer than that, because children aren't eligible yet. So our task is a little bit smaller. Of course, there are fewer of us. So I think that we can give ourselves some credit too for the organization, for the foresight and planning, and for the partnerships.
Okay.
Well, I can give you guys the credit. It's not as uh, weird for me to do it versus you giving yourself the credit. But I can tell you, and Charlie will, we talk about this a lot, is I think a lot of on Kauai, the systems that are in place with your partners are operating flawlessly. The organization, I went and got my vaccine. It was just incredibly structured. Everyone was so accommodating and helpful, especially for somebody like me who's deathly afraid of needles. They made it very comfortable. And I think when people get vaccinated and they tell their friends and relatives, God, I got vaccinated today, man, I'm in and out in 15, 20 minutes. I was done. It didn't hurt. The people were nice. I think that encourages people to go get their vaccine. And I think that's part of the success is the way the organization of this operation is being done at all levels. So I think that that's part of it. My question is, are we, and I thought I heard Dr. Pang say on the news the other night that they were having more vaccine than people coming up to register, and that people weren't showing up after they registered. Are we seeing that now that we've kind of vaccinated a lot of the people that were anxious to get it?
Right.
And now, are you seeing that maybe we're going after the segment of the community that may be on the fence or do not want to get a vaccine? Is that something that's coming into play here on Kauai?
We're certainly seeing a decrease in the amount of demand for appointments. So I think that you're absolutely right, that people who were really just chomping at the bit, eager to get vaccinated, very urgently wanted to, we were able to get them vaccinated very quickly, and that was great. And now we're not having the problem of people making appointments and not coming to them. And I think that problem is happening in places where people have a hard time getting an appointment or aren't sure that they're going to have an appointment. So they make them an appointment at multiple places and then only go to one. And that hasn't been an issue here because I think the scheduling process has been a little bit clearer and more manageable to people. But we aren't filling every single appointment slot in our clinics this week, which we have done in the past. So we're filling about 75% of our available appointments. So one of the things that I would like listeners to know is that if they're worried that it will take a long time or the lines will be long or they won't be able to get an appointment for 2 or 3 weeks, they should really just go online and make an appointment, because you can get an appointment tomorrow if you want one at the convention hall clinic. And the hospitals are mostly doing second doses of the Pfizer vaccine this week, but all 3 hospitals have appointments available next week for first doses. And then the pharmacies, Longs and Safeway pharmacies, are giving vaccine also. And they have the advantage of at least Safeway is open on the weekends.
Okay, good.
Awesome.
Yeah.
Well, I did hear Dr. Char use the term vaccine hesitancy. That was like the buzzword over the last couple of days. But I think she did a really good job in trying to explain why, and I think what caused a scare, it sounded like it because of J&J, what happened with J&J. But it seems like we may have gotten over the hurdle in some respects. And so hopefully, but I would like to say, the hospitals, the thing, I took both of my vaccination shots at KVMH, and both times I was given refreshments and donuts. So
I remember you said that. That was great. I'm afraid the convention hall, we don't offer snacks, but we do have entertainment in the observation area. Sometimes we have music. I think that I like the term that Mel used, that people are on the fence or undecided or just having a hard time making the decision to go ahead and get vaccinated. I think there are also people for whom it's not so pressing that, they do plan to make an appointment, but they haven't quite gotten around to it because we're all busy and have other things to do. So those are the people that I really just want to encourage, that, as Mel said, it doesn't take very long. It's as pleasant as getting a shot can be. The people are nice. It works really well. I think we should. Hi, Kapono.
Aloha.
Dr.
Sorry to
Kapono
join late.
in the house. Welcome, my friend. Thank you for joining us tonight. We just started, so you haven't missed a thing.
Well, I hope you guys are enjoying my different lighting situation. I was going to change the
good.
light bulbs yesterday. I ended up breaking my fan, and I was scrambling today to get lighting set up for this show. You guys are important. So just wanted to let you know.
Thank you. I've been messing with lighting for a year, and I'm trying to get the perfect lighting because, that makes all the difference. It's not the camera or the computer, it's the lighting. And I struggle with it sometimes. But thank you for taking time out of your schedule. I know we'll be talking a lot about things. Let me just get off real quick because this question just came up, and it's for either one of you. Does the vaccine agitate underlying conditions in people? In other words, yeah, will the vaccine create problems for people that have underlying illnesses? I know everybody's different. Everyone is different. That's why we suggest you talk to your private physician, your personal physician, before you get it. But in general, have you seen anything where the vaccine has agitated, as the question is posed, to underlying conditions in people?
No, we really haven't. Kapono's in practice, so it would be good for him to actually talk about what he's seeing among his patients. But the public health data about vaccine safety are actually that people with underlying conditions are at greater risk from COVID-19. So it's especially important that they be vaccinated. The most important thing about a prior history is if you have a history of an allergic reaction to something in the vaccine or to the vaccine, then that's a reason not to be vaccinated. But otherwise, underlying health conditions are actually a reason to be vaccinated rather than to avoid it.
Yeah, that would be I have a similar take on it. A lot of my patients do kind of ask me, oh, am I healthy enough for the vaccine? And generally, it's kind of like if you have medical conditions, you are higher risk for COVID. So you should think more about getting the vaccine. Agitating a condition is just not a typical medical term. So it's hard to kind of know what they meant by that. But I mean, you could think of it like someone who has a history of a hypersensitivity reaction. So like anaphylactic reactions or an allergy history, they're higher risk to have an allergic reaction to the vaccine. So in that sense, I guess you could call it agitation, and we take extra precautions for those kind of people. But outside of that condition, I don't think we would generally think of it as agitating a problem. Even the Johnson & Johnson issue that we're seeing and that we're trying to understand more about, as far as I know, it seems to affect a certain age group, more female gender, but not like they had a history of that problem before and that it came back. You know, with the vaccine. So it's not like it agitated something that we knew about before.
Okay.
But that's a good segue into J&J. Let's get that out of the way because I see a lot of questions scrolling up. What I'm seeing in the text and the post right now is where our viewers have maybe parents or grandparents that had the J&J and they're very, very concerned. So maybe you guys want to touch on that, on what's going on, what should we be looking for and such. Either one of you.
I can take a shot at it first because
go
I think
ahead.
Janet is actually more expertise on this than me. But from my understanding is it was mostly younger women. I think they were all under the age of 40. So that's probably the highest risk group. And the reaction happened, all the reactions happened 6 to 13 days after the vaccine. So there's a window sort of between 1 and 2 weeks after the vaccine when we should be concerned. From what I read, people think there's probably less risk of that happening in older people. So if we're talking about your grandparents or kupuna who got it, not very likely based on the limited information we have. But you have to remember it's only 6 cases out of, I think, 7 million. So we have limited knowledge right now. I think maybe we should wait a little bit later, but I think that there might be some reason to think there are other things related to the complications that happen. These 6 people could happen to other people, but we don't know enough yet. I want to let Janet chime in first before we get into any of that stuff, though.
Yeah, I would echo what you said. I actually think the age range was from 18 to 48, so people were under 50. But I think that the timing is really, really important. So these events occurred, as Dr. Kapono said, 6 days to 2 weeks after the vaccine. So on Kauai, we first gave the Johnson & Johnson vaccine in early March. I think the 5th or so was our first, the 15th was our first Johnson & Johnson clinic. So if you got Johnson & Johnson vaccine on that day, you're well past any period where this would be of concern. So it's really people who got their Johnson & Johnson vaccine within the last couple of weeks. To be cautious, we're saying within the last 3 weeks, but all of these events occurred within 2 weeks. And the things that people who were vaccinated recently should be looking out for are a headache that's worse than a headache that you normally have and that doesn't go away, or pain and swelling in your legs, or abdominal pain, pain in your stomach and your gastrointestinal tract. Seems like there's one more.
I think there's petechiae, like red.
And yeah, like
spontaneous
bruising
spots.
on your skin that doesn't go away. So if people have had their Johnson & Johnson vaccine in the last 3 weeks and they have any of those things happen, they should definitely contact their doctor or go to the doctor and seek health care. And that's the main recommendation. But it is, it's literally something that's happening less than 1 in a million doses. And that's an important thing to remember. And the pause that's being taken now is really evidence that the monitoring systems that are in place nationally, this is evidence of them working, because through those reporting systems and monitoring systems, the FDA and the CDC were able to identify a very serious thing that's happening extremely rarely. And to say, while we figure out what's going on here, while we look at the data, while we explore these cases, let's put the vaccine on hold so that we don't accidentally create harm in more people, figure out what we should do next. So that's what's going on right now. So even though it's a scary thing, it's also a sign of putting safety first and doing the right thing, and of our monitoring systems really working as we would like them to work.
If I might piggyback onto that too, a aspect that I hadn't appreciated until I talked to some other colleagues, including Dr. Schwartz, who's been on this show before, and he's faculty at University of Washington. There are treatment recommendations if a patient presents like this, after with these symptoms after a vaccination with especially Johnson & Johnson. So it's also a pause to teach physicians how to handle this situation. If you see someone with these symptoms, this is what you should be looking for. And it's getting a little bit into the weeds about how you treat it. But some of these we would be inclined to treat with heparin, and that's not what you're supposed to do in these situations with Johnson & Johnson until you know more. So it's also a pause to, even though these are rare cases, to inform our treating physicians in hospitals and ERs, hospitalists, how to handle this situation to prevent harm as much as we can if you run into it, however rare it is.
Someone asked about, I guess Dr. Miskovich was on the news last night talking about low platelet counts, and maybe that had something to do with the J&J. I didn't see that, so I that's all. I'm just reading the question. Any info on that? Something to do with low platelet? I know Charlie may even have seen it. I just didn't.
That's part of this rare event that's being seen as people who have the combination of symptoms of a very low platelet count and very significant blood clots. And that's unusual in the medical world because platelets are part of clotting. So when you have low platelets, you would expect you to be less likely to have a clot. And so that's why, as Dr. Kapono was saying, the guidelines for physicians about how to treat this are really important, so that people are looking for this complicated and unusual clinical picture and then can treat it appropriately when they see it.
Okay. Well, I do want to let our viewers know and thank them for the questions that's still coming in. But everything that we're discussing has raised a little light bulb to go off in our heads to think that, it's something that we need to watch out for. But, in no way are we trying to diagnose anything on this show. We're just trying to get the information out to dovetail on what's already been spoken about on the national level. And so I hope everybody understands that. And thank you for all your questions. Now, I kind of want to move into something that they're talking about doing, and that's the vaccine task force. I know Kauai was very, very strong-willed in the beginning, thanks to you, Dr. Berreman and the mayor, because we knew that in order to keep our numbers down, while we saw other areas kind of picking up, we knew that we had to find a mechanism or a method to kind of, get everyone checked out before the all clear is given, right? Now, given that Kauai has opted back into the Safe Travels program, we hardly see numbers, and I think that's attributed to because we're not testing anybody, correct? Unless somebody presents a serious problem, or how is it working? How is that working?
Well, I would have a number of things to say about how it's going since we opted back into safe travels. One, it's only been 10 days, less than 10 days. So it's way too early for us to know whether we're going to see cases arise from that. The travel industry has been very active in providing incentives in the form of something called a COCUA card for any visitors who do go ahead and voluntarily get tested 72 hours after they arrive here. So testing is going on, and the free testing at the convention hall for anyone. Primarily, we're focusing on residents, but anyone can come Monday through Friday and be tested there. So there's a lot of testing going on still on Kauai of people who are not sick or symptomatic, as well as, of course, people who are concerned about symptoms. So I would say we are doing a lot of testing, and it really hasn't been long enough yet for us to see the impact. But we're not testing everybody.
And the only reason I'm saying that, several nights ago, there's a gentleman that stopped off on Maui because of what Maui is proposing to do, and that is doing pretty much the same thing as the Big Island, right? And that is post-arrival testing, get them as soon as possible. And this gentleman who is a visitor did make the comment, and I thought it was kind of striking, and he said that, understanding that the rules are changing, the visitor might want to think, what happens if he does test positive? Is his vacation ruined? Just by those kind of thoughts, I was thinking to myself, okay, I hear something that may be coming down the pike. Because what we're offering on Kauai is really voluntary. You try to entice them to take the test.
Right.
But again, if that test does come out positive, and I'm hoping, there'd be a good neighbor that they don't want to get anybody sick, that they'll follow the rules of the engagement, and that is stay quarantined in place, not move around.
Yeah.
So those are the kind of things. It's many of us is trying to understand how this program will work.
So if people test positive, those tests are required to be reported. Actually, all tests, negative and positive, are required to be reported to the Department of Health. But we have clear agreements with everybody doing testing that the positive tests will be reported promptly to myself or my staff. And at that point, we work very closely with people to ensure that people who have tested positive are in isolation until they're no longer contagious. And so that's not really something that people opt into or out of. If they are attempting to opt out of that, we can work with the Attorney General's office and get a court order to encourage them more strongly to remain in isolation through the period of their illness. Most people, as much as they don't want to ruin their vacation, they also don't really want to make our community sick or cause harm in the place that they're visiting, because most of our visitors feel fondly about our island.
Go ahead.
No, go on. Well, Charlie led by talking about the vaccine passport, and I think I heard implied in that a question about would being fully vaccinated make you a safer visitor or safer traveler. And I think that the medical science and public health science certainly says yes. The challenging task is how to reliably validate and verify that people have been vaccinated. And I think that's what the Lieutenant Governor is working very hard on, so that there's actually a mechanism to do what he would like to do.
One of the things the Lieutenant Governor talked about was for inter-island travel that the physical card itself would be sufficient, and I just don't think that is a wise thing to do. And I think before you came on, we were talking about the governor saying that he's waiting to make sure that the logistics are in place, that there's a process, a system in place to do exactly what you just talked about, to validate these vaccination cards before he makes any moves. So that's good to hear. That's good to hear, because we know, and we've shared it on the show, where you can actually purchase these cards, these CDC cards online. I mean, it's not hard to falsify one of these things. Very simple to do. So that's always going to be a concern. So that's just something we just got to wait and see. We did have a question. Do you know or have you heard if tourists are getting vaccines from the pharmacies in Hawaii? That someone just posted that a little while ago. I thought that the vaccines were for residents only, but are you aware, or is that something that the pharmacies dictate and can do? There's no prohibition for a private pharmacy to administer a vaccine to a non-resident?
You know, the pharmacies are getting vaccine directly through a federal distribution to the pharmacies program, and I don't actually know the details of what the requirements are. I know that at our the states that are the sites that are affiliated with the state, including the hospitals, are not vaccinating tourists. We're vaccinating residents.
Yeah.
I don't know either. I haven't heard reports of that. I know that that's been a focus of viewers on the show before. And I think at this point on Kauai, it should be really accessible to get vaccinations for residents. And I don't mean to ignore that problem, but those visitors do present a risk. And I wouldn't focus on it that much at this point. I mean, we're always going to prioritize our residents. It did make it a little bit more of a kind of like when there was just a single dose Johnson & Johnson, would people just come in just to get a single dose? And then, only for that purpose. But, for Pfizer and Moderna, it's 21 or 28 days apart. And I've always said, if they're going to stay here long enough to get their second dose, I would be inclined to treat them. But as far as I know, nobody is trying to, cater to travelers and give them vaccinations. And we are even on the website, we're advised that, we serve residents first for sure. I'm just going to say personally, I'll admit that, it's not something that I would be, trying to exclude people here and there if there was a reason, why we could help someone get the vaccine at this point, because our vaccine slots are sometimes not being filled. And we have that problem with the vials, where you need to get 10 people, or if it was 5 people with Johnson & Johnson, 10 people with Moderna. So sometimes you have to scramble to get to get a treatment. And there's kind of some gray areas too, so, if it's your family member that's visiting you and, they're not just a tourist, or a kid who's home from college, that kind of situation where they're not really living here. I think most of us would agree that we'd want to accommodate those people. So I just want to admit at this point, I would be more inclined to give it than to stop somebody who is seeking it, unless there was a big wave of people kind of, and we could tell that they really were trying to game the system and kind of jump ahead in the line.
And I haven't really heard of a shortage of vaccines here from our residents complaining that they couldn't get a vaccine. I think right now, maybe early on when the wait was a week, 2 weeks, 3 weeks, now it's not the case. Like Dr. Berreman said, you could make a reservation for tomorrow, your appointment, and you get a vaccine. So as long as the supply and the demand are okay, and the visitor isn't taking away a dose from a local resident, I would tend to agree with you, Doc. But there is it is happening at Safeway. The person just posted, there were 2 couples that were visiting that had their vaccines the same day and time when my husband and I got ours at Safeway. So I guess that's the confirmation, but I hear you, Doc.
Could I add, Mel, in terms of the ease of getting vaccine, that at the convention hall, we're now accepting walk-in patients who are 60 and older, and also people whose English language skills are limited. So on the Tuesday, Wednesday, Thursday clinics there between 9 and 11, if you're 60 and older or you need help with English language, you can just walk up and we'll help you through the entire process there. So you don't even need an appointment.
I wanted to point out something. I think Janet said, or Dr. Berreman said this briefly, but it's also the pharmacies they're not really taking Hawaii's supply. They have a separate federal supply. So I think that's another thing to point out. It's not taking away from what the state of Hawaii is allotted.
So basically, what's allotted for the state of Hawaii is for the state. There's no question about that. All the additions, like these pharmacies that participate on a federal supply, what you just said, they're coming from a different pool of vaccines that's readily available that basically can be given out to anybody because it's not affecting the Hawaii residents, correct? That's what you're saying, right, Kapono?
I'd imagine there would be some caps on it if they were running into, there must be a limit as to what they could do. But to give an example, our community health center, which is a federally funded community health center, we are transitioning to order our vaccines from HRSA, the Health Resources Services Administration, so a different supply from the state of Hawaii as well. I'm sure the supplies are not infinite, but we don't get the sense that there's a big limit. I mean, they put a cap on it, but it's something like, I think we could get something like 2,000 doses of Moderna a week or 9,000 of Pfizer. I mean, way beyond what we would want. So right now, the supply chain for the vaccines to us sounds like it's only going to get better.
Good. That's good news. Now, someone did post that, and again, as you know, a lot of our viewers, we have mixed. It seems like we're across the board on each island that watches this show. And one of our Oahu viewers have said that they've been having difficulties in scheduling appointments. And I guess with this hold off with the J&J, it kind of threw a wrench into the fan here. So, everybody is scrambling, but they said that on Oahu, there are a lot of times where there's just not enough slots opening up to go get vaccinated. But from a national level, it's just like it seems like the companies like Moderna or Pfizer, they're just burning it out. They're just pushing it out as fast as they can. So I don't see any reason why we don't get our fair share in the state. Now, let me ask you, since we are a travel destination, those coming in from other countries, what's the vaccination like? I mean, we hear Israel all the time. They're like the premier leaders in vaccination, right? I mean, they're almost at herd immunity rates right now. But what about the other countries? How are they doing? Because they have travelers that come to the U.S. as well. I mean, are they kind of keeping up to speed with vaccinating their people, or and because I don't know if they're on the same system, how do we validate if they're vaccinated if they come in, like say come into Kauai? How does that work?
Well, so we're not there yet at all, and I think what the lieutenant governor is proposing is a gradual introduction of being fully vaccinated as a way of exempting you from the need for a pre-travel test. So he's proposed doing that initially for inter-island travel, and then doing that for domestic travel from the rest of the country, and then down the line looking at that internationally because of the issues of documentation, different vaccines used in different countries that aren't licensed here, different languages, different names. I mean, it's a complex issue even for inter-island travel, and the challenges are much greater internationally. The United States is actually doing very well in vaccinating our population. We had some of the highest levels of disease, which was not something to brag about, but now we have some of the highest levels of vaccination, not on par with Israel, but still we're doing quite well.
Not good.
I want to shout out to Roxanne Freitas. She posted that she was on the fence, and from watching this show, and I'm not saying this to brag, I'm just saying we've had guests come on the show to talk about vaccines. We had CJ Johnson and Blanca from your office on Monday night, and they were fabulous. They explained. Anyway, Roxanne got off the fence and had her vaccine today, her first shot today. So that's what's going to do it, people. It's we're not trying to coerce people to get a vaccine, but we want to share the information, the factual information on the benefits, so we get as many people vaccinated as possible. So just let Blanca know when you see her tomorrow, if you do, that we appreciate her and CJ. Their message was clear and very objective. And again, for Roxanne, congratulations, girl. That's how this works, word of mouth. And then one more thing, Kokua card I know Sue Kanoho was on earlier. One of the hotel employees posted that, how can the employees get trained in the benefits? What does it entail, so they can inform and educate their guests and encourage them to participate with the Kokua card program. So Sue, if you can get to the marketing people from Kokua card and see if we can somehow get the word to the employee level, because yeah, the employee people, the bell guys, they're face to face with these guys. They're the ones that's going to sell the program. So that's a good point. Roxanne says, I almost chickened out, but I did it for my mom. That's cool.
Good for her.
Awesome.
We may in the coming days and weeks be looking for people like Roxanne who'd be willing to do a really short testimonial video, like 15 seconds why I got vaccinated, or whatever your personal story is, because we know that it's one thing to listen to doctors, but it's another thing to listen to your neighbors and friends and people that saying, yeah, I was worried about it too, but I did it and I'm really glad I did. So keep an eye out for that.
I think Roxanne's story is a good one to highlight too, from the limited thing I heard. But I think we are, now we're getting into these younger age groups where there might not be as much risk to that individual as far as COVID goes, but they might have a family member who, they could potentially transmit it to, and that family member could have complications. So another patient of mine just signed up today, young woman, and she's concerned about her younger brother who is immunosuppressed and has chronic medical conditions, and that's what convinced her too. So I think people, we've said it time and time again, but I don't think it can be said enough that we really look at this as something as far as taking care of your family, taking care of your community when you get vaccinated.
Well,
Reina Pia is a nurse, frontline hero, superhero, frontline. Reina just said, pros outweigh the cons. Simple as that.
Well,
I was going to say,
go ahead.
As people are going back to work with less restricted travel and more tourism and travel related industry here, I know that people have been hurting and haven't been able to work as much as they'd like in the last months. And being vaccinated really protects you from getting sick and having to miss work. But it also means that if you're a close contact of a case, you won't be required to quarantine. You can continue going to work. So there are selfish reasons for young and healthy people to do it also, in that it keeps them from being subject to isolation or quarantine by the health department.
Well, I was going to say that, I think for our viewers out there, if you think about this whole thing as just one big net, as long as there's pukas, the safety of that net is not going to be safe. We need to cover every single square inch of that net and make sure we fill up those pukas in order for it to work. And I think that's the only way, this whole vaccination program can work. I know that when we first talked about vaccination in the beginning, and I admit I was over there thinking, okay, what is that? But then, we know that, okay, we're going to lessen the symptoms. But my hot button topic was, can we still infect somebody else, even though we're vaccinated? And that was a long drawn out process. But I think, there's been some reported cases that people were getting sick after they've been fully vaccinated. And I'm pretty sure the CDC and, everybody else that's on this planet that's even involved with this is probably taking a look at it and see, what are those isolated cases? What are they about? But I think for the most part, like common folk like myself, we should just be happy that we got vaccinated and that, we got that level of protection that, we're not going to be severe enough where we'll end up in hospital. Hopefully, and again, I said this a couple of times that, when we talk about it being rare, I can only imagine that family that said, well, I heard you, Uncle Charlie, you said rare, but my loved one got it and they got it really bad. So why did I stand out? The word rare shouldn't be used. And I think in some ways they're right. I think we should just be cautious at all times. We should just be cautious.
Well, that's a good point, Uncle Charlie. And I think you have to add on to the point that it's rare, but it also feels horrible to think that we did it to somebody. That's the opposite of what we want to do as physicians and as public health experts, however rare it is. So that's why we take it seriously. And you can see with the Johnson & Johnson vaccine, the experts did take it seriously, however rare it is. So it's no condolences to the family. I understand what you're saying. You know, when we call it rare, it doesn't matter to them because that's their loved one. But you know, the statistics are also true, and I think people point it out because they don't want people to be overly hesitant and ignore the fact that COVID-19 also causes clots and causes them at a much higher rate and causes complications at a much higher rate than these vaccines. But you know, COVID-19 isn't being promoted by public health experts and doctors who are charged with taking care of people. So we take it more seriously. And you know, the history of vaccinations too, we understand that, and you know, we don't ever want to go down you know, the bad history of some of the vaccines and how they were handled in the past.
You know, Dr. Berreman, and this is my last question before I turn it over to Mel. You know, I wanted to find out about the variants. You know, like California seems to be like the epicenter of variants for some reason. And yet in the travel industry, we know that most of travelers come from California. So far, the state of Hawaii, have we been lucky that we haven't been tagged with a larger number of variants? Because it seems like when there's been widespread cases and the variants were involved, it just spread like wildfire. But we're not seeing that in Hawaii.
Well, actually we are. So the California variant is called B1429. You know, public health people come up with these names that nobody can remember. But that is one of the variants that's a variant of concern according to the CDC, and it's of concern because it spreads more easily. It's not the one from England, B117, but the one that's dominant in California is B1429, and that is actually now the most common variant of COVID-19 on Oahu and on Maui. So it's definitely here and it's definitely spreading.
But you know, just by the numbers that's released every day from the Department of Health, and that's the reason why I'm asking. The numbers seem so low. You know,
the numbers on Maui have been quite high over the last few months. They seem to be settling down a little bit, and the same with Oahu. It was rising more than we expected it to for a while. So we don't really, I would say that we don't know yet what the impact of that variant is going to be, and that it's very concerning that it has gone from, you know, very few cases detected to now being the dominant form on Oahu and Maui, where most of our statewide cases are. So the department is continuing to monitor that closely.
I wanted to echo that too, because I feel like there's been some misinformation in the mainstream media about not having much difference from island to island, and that has not been the case recently. And Maui's case rates really, they're higher than some. We made the comparison to Seattle, but they're higher than some of the metropolitan areas on the mainland, you know, per population. So, I mean, I would say Maui is a pretty clear example of where a variant got out of control, and that was the effects. It's not the, you know, I guess it's not the raging fire that you see in a place like New York City, because Maui's a different place, but per population, the rates were very high. As, you know, kind of rates were coming down on the mainland. Maui's pretty much a hot spot if you're looking at the entire United States.
Well, I think the only reason why I asked it was just because from a comparative standpoint, when you look in the teens, right? Some of us that just are looking at that, you know, we say, ooh, when you get up in the 20s and 30s, then it starts to get worrisome, right? But when it remains in the teens, like say between 10 and 15 or 16, it's like, oh, okay. But yet there are times when they hit 30. Oahu, at times they're coming down, then boom, they ramped up to about 72 cases. So I think there's that sense of comparison where if you just took the average Joe looking at these numbers, they're saying and I think that's how everybody else is reacting. You know, they say, you know, the numbers are so low. You know, you're looking at, you only got 40, that's low. But yet what you're saying is actually it's high, but we don't see it that way. And I think that's something that we got to be educated at, because if we see something that we think is low and it's actually high, And it should be something we should be taught to say, okay, let's kind of be a little cautious here, because even though in our minds it's low, it's actually high. And I think that's kind of the problem we run into every time.
Yeah, Lauren Pang is always good about asking what's the denominator, not to get into the math, but it's hard to know these frank numbers if you don't know what the denominator is. Doesn't mean 10 out of how many. So I think you can kind of rule of thumb think of Oahu as being maybe 10. It's not really 10 times as much, but just to make easy math, 10 times the people on Oahu. So if you have 30 on Maui, the comparable number would be 300 on Oahu. So you kind of have to think about it that way. And if you compare it to a place like Seattle, gosh, sorry, I don't want to misquote, but I mean, it would I'm almost certain it'd be hundreds, maybe thousands, would be the same rate.
Okay.
And you got to remember, on the mainland in these metropolitan cities, you got a lot of people crammed into a very small area. And, we're blessed here in Hawaii because we're somewhat spread out. That's why it's so important to not have those underground parties and those gatherings and the hundreds of people coming together in a crammed up location, because that's how this variant will spread rapidly. And I think that is the message, I think a lot of people are trying to get out is, hey, I think Charlie hits it on the head. When people look at the numbers and we're so far behind the big states on the mainland, we think it's okay. We let the guard down. It's okay. It's a wedding. It's a once in a lifetime event. I'll wear my mask. I'll stay distance. And once you get there, all of that gets tossed out because it becomes a family party, and you haven't seen people forever, and people let their guard down. So that's why it's so critical now with these variants running around that we gotta be very cognizant of that. I just wanted to read a comment from one of the Shauna. I don't know if she's still on, but she said, "Thank you for covering everything and respecting our views that are based on bad experiences with vaccines. We are concerned for a reason. The expert Manao is helpful. Mahalo." I'm gonna tell you, Shauna, and Charlie knows this. I was on the fence for a while, and for that specific reasons, I had a prior bad experience with a vaccine. And I was very nervous. And when my doctor told me to hold off, I was so thankful and happy, because that was my excuse. Like, hey, Charlie would ask me all the time, "What now? You gonna take the shot?" No, my doctor said, "No, wait." My doctor said, "Wait." And as I started to hear from experts, as I started to read, and I realized that, you know what, I think it's time we have that serious discussion with my doctor. And we did. And she said, "Now, yeah, go ahead and get your vaccine." So I understand, Sean. I appreciate the very professional comment. And yeah, we understand there's people that are hesitant, and we're by no way trying to force you, but we are trying to provide the information that is real and factual, and you make the decision. So thanks for that. I love when people share their mana'o like that in an open and, of course, professional, courteous way.
But can I share one thing? And that is, when someone is afraid of a needle, but you want them to get vaccinated, don't go making up boogeyman stories that the needle is about this big, okay? Because you will not succeed in getting that person vaccinated. And I'm not going to mention names, no proposal. But anyway.
I never said that. My needle was so small.
I can chime in on that. And one of the learning experiences we had was that if the needle is actually too long or too big of a gauge, you end up wasting a dose. So the first time we started using the vaccine, we only got 9 doses out of Moderna, and we were trying to figure out what happened. And it was because the needle we were using to draw up was too big. So it's related, but generally, that too big of needles are problems. So we don't use needles that are too big.
Well, I honestly don't know what the size of my needle was, because as soon as I sat down, I went the other way, man. I don't know. Go ahead. I had to be distracted. But anyway, Shauna just responded that she did get the shot, though. Congratulations, Shauna.
Yeah. Very
I
good.
will say that I spent a couple of mornings giving vaccines at the convention hall, and spoke to plenty of people who didn't like needles and were afraid. And a good number of them said, "What? It's finished already?" So, it doesn't need to be a painful experience, but I have a daughter who's extremely afraid of needles and have held her hand many times for shots. So
Well, I went down to the arena or whatever, the auditorium to get my resting area, and I forgot my phone at the desk. I was so nervous where I got my shot. I went back up, and the lady says, "What's wrong?" I said, "Can I get a second one? Can I get another one? That felt so good. I want another one." And she out because she thought I was telling the truth. Anyway, real quick question, Dr. Berreman. If a state of emergency was ended tomorrow, if it says, okay, boom, would the DOH still be vaccinating people? Do you
Sure.
know that?
Well, I'm not sure if if the pandemic were completely over and COVID-19 somehow vanished from the earth, then we would stop vaccinating people because there wouldn't be reason to. But as long as it's still circulating, we'll still be making an effort to vaccinate people.
Yeah, and I think as long as the pandemic is alive, that the governor would not end the state of emergency, right? I mean, it's going to be there until we eventually kick this thing. So hope I answered you guys' question. I know there's so many questions. My God, I'm trying to pick the ones that are the state of the emergency. Okay, yeah. Anyway, woo. What
Maybe
else?
can I comment on something that was a little bit back about residents and staying cautious about gatherings. Dr. Berreman has a better command of the cluster report, but these cluster reports come out from the DOH every week, I believe, and they're interesting, and you can see them by island about where things are happening. So there's churches, restaurants, bars, those are the things that have come up repeatedly. There's a fitness centers on Oahu earlier in the year, and they came up with some recommendations regarding that. So we know some of the areas of concern. I do think that we should praise our residents, though. I mean, we are good about masking, and I think it's been a successful campaign to emphasize it, and our resident behaviors have been good. So I think that has a lot to do with our ability to absorb pandemic COVID risk and not have surges. But at some point it can be overwhelming, and I think that's what happened on Maui. If you compare the numbers of visitors to the number of residents on that island, it's a lot different than Oahu. Even though Oahu might host a lot of visitors, the resident pool is much bigger. And so, not all visitors have problems with, masking and behavior, but we know some of them do. And so I think, to me, it was partly the variant on Maui, and partly that, the resident population was probably got to a point where they're overwhelmed. And there are some bad behaviors too. There was a concern about, I think there was a mega church that was still holding services. So we should point those out, but I do want to give our residents some credit, because I think that has a lot to do with why Hawaii still hasn't seen, major surges throughout safe travels, because it only has, a certain amount of protection that it can provide.
The other thing is, like I said, how I said it before with that comparison factor. Now we look at clusters, and you mentioned at bars, churches, gatherings. It shows where these clusters are. And this is, I understand the mayor, and I'm talking about the mayor on Oahu. He puts in a request to kind of relax the restrictions or modify tier 3. So that's why, again, the average person is looking at that, and maybe they got all of the DOH report. They say, okay, we see where a lot of clusters are in gatherings, bars, and they're trying to increase the capacity at bars. It doesn't make sense. And I think somebody got to give the right message that, okay, we have these clusters, they might be isolated. Then people ask the question, something they'll ask us on private messaging. Hey, Uncle Charlie, does it make sense? Does it make sense to you that we have a cluster? It's bars was one of the major contributors. And yet Oahu is asking for opening up bars even more. And I don't even know how to answer that. I don't. Because, they're looking at it from the standpoint that, okay, we're trying to curb this darn thing. And yet officials are trying to open it up. The common sense person would tell themselves, it'd be hard to curb something if you're going to open it up knowing that the danger exists, right? If it's a dangerous situation, you don't want to go near it. And those are the kind of questions that we've been fielding all this time, and it makes it hard for us in trying to understand it.
I would say, Charlie, that the tier system on Honolulu, I mean, it is the city and county system. It's not the Department of Health system, but it was developed in close collaboration with Dr. Char and Dr. Kemble and myself. And I think it has served the city and county quite well. And as changes in that have been proposed, the Department of Health has been consulted, and we have advised against making those kinds of changes. So, if that's helpful.
Well, that's refreshing.
Yeah, that's refreshing.
It is. Because we hear the news, and that's why I love this show so much. I love people like you when you come on, both of you. You just, because what it tells us as the lay people that we have a Department of Health that is concerned. And Dr. Berreman, it's not the first time that the Department of Health, especially our Kauai office, has stepped forward and spoke in the best interest of the people of our island and our county. So I appreciate that. And we're concerned about those things. We can read the cluster reports, and why would you want to open up potential cluster spots because of business? But we only can do so much. The city and county was able to get the approval. So it is what it is. I got a question real quick, medical question. Is it true that the Pfizer or Moderna vaccine can interfere with a woman's reproductive system? A nurse told me that's why she was waiting for Johnson & Johnson. I have granddaughters and I worry.
You want to take this one, Kapono, or you want me to?
I can go first. I'll take a shot at it. I think the answer is really that we don't know for sure, but there's no reason to think that it does. I have not heard any reason to believe Johnson & Johnson would be safer than the other ones as far as the potential to interfere with the reproductive system of a woman. I believe that there was some reports about affecting fertility, and that was disproven to my knowledge. I know that there were, now I don't want to say the wrong number. I want to say it was something around 20 women that became pregnant during the trials for Pfizer and Moderna and did not have complications. Overall, the trend has been, from what I've been hearing, has been to make sure to offer the vaccine to pregnant women and breastfeeding women, not to exclude them. And it seems more and more that the physicians that I know are actually recommending it for those women. So that's what I know. I think we're waiting on more definitive data, but Dr. Berreman might know better data on it, but I believe we're waiting. But it is becoming the trend more that I'm hearing recommendations to get it for that population.
Yeah, I think pregnant women and breastfeeding women are considered a special population. And when they haven't been included in large numbers in the original clinical studies, the FDA and the CDC are very cautious about making recommendations for using vaccine in those settings in the same way they would be with very young children or people with compromised immune systems. So the cautionary note of, you should discuss it with your doctor in making your decision, I think reflected the fact that it hadn't been given to as many pregnant women as we would like to really see value in the safety of it. We've now given Pfizer and Moderna, we're approaching 200 million doses of those two vaccines combined in the United States. The last time I looked, it was about 185 million doses. And I don't know the data about how many pregnant and breastfeeding women there have been, but there have been many more, and there's been no indication of any, and there isn't any sort of biologically plausible mechanism that we would expect there to be an impact on fertility or on pregnancy. And the other thing I would add is that we do know from the many cases of COVID-19 that we've seen that women who are pregnant are at higher risk of severe disease and complications, and they can even lose a pregnancy due to the infection of COVID-19 itself. So that is something for a pregnant woman to weigh into her decision about whether or not to be vaccinated. And for breastfeeding, we're learning that if the breastfeeding mother is vaccinated, the antibodies that she produces go into her breast milk and actually, like antibodies to many things, are then absorbed by the very young infant and protect that infant. And that's one of the natural ways that our bodies protect newborn babies from serious disease, that they get immunity through the breast milk from their mother. So again, that's to me a really good reason for a breastfeeding woman to strongly consider being vaccinated.
Thanks for making that point. I forgot about that, but yeah, that's becoming a motivating factor, it sounds like, for a lot of breastfeeding women to protect their baby.
There's a few comments about that that's kind of the reason people pregnant mommies got vaccinated, was so their babies could get the antibodies. That's pretty cool. I didn't even think about that. I'm so thankful I'm a guy. It's the less thing I got to worry about.
Mothers have amazing powers, and that's one of them.
That is true. That is true. Well, we are at the 8 o'clock hour. Any closing thoughts from each of you? I think, as we, I don't want to say turn the corner, but as we move along in this crisis or this pandemic, we have opportunities right now available to help our communities. So whatever you guys want to share, Dr. Kapono, you can go first.
Well, I would understand how this Johnson & Johnson hiccup has made people pause, well, we're pausing the vaccine, but pause and think a little bit more about the vaccinations. And I don't blame anyone for thinking along those lines. I just want them to understand that, we're here to try to make it easy and accessible and be honest and open and have the conversations that people need to have to get the vaccine. We generally recommend it for most of our population. And I think both Dr. Berreman and I view it as a way to further strengthen and protect our community from the pandemic risk. And it's sort of the hopefully the finish of all the work that we've been doing over the past year to protect our communities. So I would encourage people to think deeply about it. And if you want to have a conversation with a doctor, our doctors are available. People can reach me on social media too, through Facebook. But we want to be available to have those conversations, and we're not trying to bully anybody into it. I kind of look at it as always planting the seeds. We'll keep on planting the seeds, and hopefully, whatever motivation pours the water on it, those seeds grow, and eventually people come around once all the factors come together. But we're cautious. I hope people understand that too. Like Johnson & Johnson, it feels like a setback, but it should also help people understand that we're cautious, we're safety minded, and we're just trying to navigate through this the best that we can and provide the best safety that we can as well. So we'll keep doing our part, and just want to encourage the community to keep doing theirs as well.
Dr. Berreman?
Yeah, I echo what Kapono has said. I also want to say that we all hope that this is the final stretch and that the end is in sight. And I do think that we're in a precarious time when we don't know what the coming months are going to hold. And many people have characterized it as being a race between the vaccine and the variants. And I think we're very much on that cusp. And so I would encourage a couple of things. Certainly encourage people to be vaccinated. And that we know is going to take some time. With 2 doses of vaccine, they're separated by a few weeks, and it's 2 more weeks before you're immune. And we've just opened up to safe travels, which poses another threat to our community. So right now, and in the meantime, while you wait for your vaccine to take effect or wait for your appointment, it's really important that we continue all those things that we're all a little tired of, and that I know people are tired of hearing me say, but wearing masks and avoiding large gatherings and washing your hands and keeping your distance. And if you're sick, staying home, as well as getting vaccinated. Those are the things that have kept us safe, and that, fingers crossed, I really think can continue to keep us safe while we get enough of our population vaccinated to really prevent the spread. And I also just want to say an enormous mahalo, as you said, to our community, to those people who have been vaccinated, who have been on the fence and are making the decision to be vaccinated, and for everything that people have done over the last year to bring Kauai through this year as strongly and healthily and safely as we have. So mahalo.
Thank you, Charles.
Well, as always, I'd like to say a big mahalo to Dr. Janet Berreman from the Department of Health, Hawaii Office, Health Officer, as well as my good brother there, Dr. Kapono Chong Hansen from Ho'olahui Community Clinic. For everyone out there, I can only speak from a personal experience, and that is losing a loved one is hard. You're given the chance to take a vaccine. Think of it this way. Prior to this pandemic, I take a flu shot every year. And I believe that every year, when you get your flu shot, it has to be tweaked a little because certain things happen, right? But you don't really care. You just take it. We'll get over this, and at one way or another, this vaccine process that we're going to go through is probably going to get to the point where it's going to be out of sight, out of mind. Just take it and get yourself protected. And I think as long as we can all jump in the same boat and all be protected, then we can be safe all around. But again, we have to take the precautions, even though you're vaccinated, wear your mask and social distance, wash your hands, and avoid large gatherings. As long as we can do that, you can be assured that you'll be safe. But always use this first, okay? We can give you the information, use what you can absorb. If you can't, let it go, wait for the next show, we'll bring on some more information. But always use this first. Don't rely too much on what you think and without trying to validate it. We've got two experts with us tonight. We consider them very much experts, and they've been on our show before. And what they've said has really put a light at that end of the tunnel when we thought everything would be kind of bleak, but it looks pretty good from this vantage point anyway. So I'd just like to say again, thank you to them, and thank you to all of our viewers tonight for tuning in. And I'll turn it over to Mel.
All right, thank you, Dr. Berreman, Dr. Kapono. It's always a pleasure having, it's awesome having both of you on at the same time, and I hope we can do this again soon. As things change and develop, and we love the updates from people that are frontline. To all of you out there that are working frontline, you guys are heroes. We appreciate each and every one of you. I love the engagement that we're getting with the viewers. I know Shauna and Roxanne, making the decision to take the vaccine, and when we talked about it, you saw the hearts and the shakas and all of that floating up. We appreciate you guys, and it's again, and my dad, my dad was another one. I forgot to mention him tonight, all the way in Seattle, in Linwood, and he was on the fence until I forget what show it was. He decided to go get the shot, and he's taking his second shot on the 24th, which is his birthday. So I'm proud of him as well. So many of you that want to help, how can you help? I saw Sarah put this up earlier. If you want to share your story, sblaine@kauai.gov, sblaine@kauai.gov. Shoot her a quick email. Let's get you folks sharing your story for everyone to hear. And for those of you that, rather than try to remember Kauai, Oahu, Maui, Big Island, we found out last night that you just dial 211 and you will reach a human being, a person that can help you schedule a vaccine, or if you need transportation, or if you're living somewhere outside that you need outreach, 211, and that's the number to remember. So please, all of you, if you have a testimonial to offer, please email sblaine at Sarah Blaine, sblaine@kauai.gov. If you need questions, if you have questions about getting a vaccine, contact your personal doctor for availability and reservations. Just call 211, guys. Let's get this thing done. Let's kick COVID's ass as soon as possible. Oops, sorry. But anyway, guys, we appreciate you guys. We love you guys. We'll be back on Friday, Feel Good Friday. Hopefully we can get some businesses on. We'll see how it goes. All right, guys. You guys take care. God bless. Let me get my button ready. Aloha.
Aloha.
Aloha.